Pharmacology Exam 3, covering the last part 3 of nitric oxide lecture. Again, a quick review. Nitric oxide is found in 3 cells: neuronal, inflammatory or macrophages, and endothelial. These two, neuronal and endothelial, are by calcium, and this one by inflammation, and that's macrophages in the middle there. Also, they can bind to metalloproteinases, thiols, tyrosine. Okay, so first of all, what we're talking about is a little continuation of the last lecture where I was saying that there are alternative methods of interacting with nitric oxide in our body. One of those methods I said was to enhance nitric oxide downstream. Okay, so later on, as its effects in the cell, you're enhancing its effects. And the drug that I mentioned here was sildenafil. I said that sildenafil inhibits 5-phosphodiesterase. Phosphodiesterase, 5-phosphodiesterase, is an enzyme that cleaves cyclic cyclic adenosine monophosphate and cyclic guanylyl monophosphate. Okay, what is cyclic? I just call it GMP. What does cyclic GMP do? Cyclic GMP causes smooth muscle relaxation. Your blood vessels are lined by smooth muscle. If you relax that smooth muscle, it's going to cause your blood vessels to dilate. If the blood vessels dilate, you don't have hypertension anymore. You might have hypotension, low tension of blood vessels. If they were to constrict, you would have hypertension. Okay, so if you inhibit the enzyme that breaks down cyclic GMP, this is a lot of multiple steps here to think about, and you know that cyclic GMP is what causes vasodilation, then inhibiting the thing that breaks it down is the same as increasing the amount of circulating cyclic GMP. If you increase the amount of circulating cyclic GMP, you're going to have more vasodilation. Okay? So the effect of phosphodiesterase inhibiting drugs is that they cause vasodilation through an increase of cyclic GMP. Okay? Now there are 4 drugs that are antagonists or inhibitors of phosphodiesterase 5. By the way, there's also phosphodiesterase 6 that's mentioned, and he also mentions phosphodiesterase 11, but not much is said about them. Other than 6, if you have too much of it, apparently it does something with your eyes. It makes you see more blue. That's kind of odd. Anyway, so all right, let's talk about these antagonists. Well, one thing that's kind of nice about these antagonists is they all end with afil. Afil, okay? And this is basically what these drugs do, sildenafil and these ones, is they help treat erectile dysfunction. So if a person is having a difficult time having an erection, they will help fill the corpus cavernosum of the penis to allow the person to have an erection. So in that sense, you can remember sildenafil and Vardenafil and Tadalafil and Avanafil all help to fill in an erection, so you can have successful erection. So how are we going to memorize the differences between them all? Okay. So first of all, sildenafil. Sildenafil has 40% bioavailability, which is relatively high. Okay. So that means the amount that you put on here is going to be increased relative to the next one, which has only 15. So maybe what you could think of that is that it sildenafil seals the filling, okay? So it seals it by having a lot, okay? So it's 40% bioavailability, so you don't have to take as much of it. And this one actually is also relatively stronger than 6-phosphodiesterase, so it inhibits 6 as well as 5. Normally this is 5 up here that we're talking about for this. It does 6 also, so this one actually is related to people having blue vision, okay? So S for they see blue vision, okay? And also S for 6. S for 6, S for C, for seeing blue vision with inhibiting 6. Next, Vardenafil. Okay, Vardenafil, this one has only 15% bioavailability. That's a lot less than the other one. So how do they handle this? Well, they just give the person more of it. And giving more of it increases the effect, obviously. So it also is a 6-phosphodiesterase inhibitor, but it's a much weaker one. So it's a weak phosphodiesterase inhibitor, which, I mean, it's like less than half as effective as the other one anyways for the 5 as well. So I guess that kind of makes sense. And it's also approved for treatment of BPH, which is benign prostatic hyperplasia. As you know, when a person's bladder is full of urine and they need to relieve that urine, the urine goes through a little tube, and this tube passes through this thing called the prostate. And when the prostate becomes hyperplastic or whatever, it gets big, it kind of squeezes down this tube and the person has a hard time urinating. And so apparently if you give them Vardenafil, that can help to treat this benign prostatic hyperplasia. I don't know exactly how it treats it, but supposedly helps treat it. Next is Tadalafil. I'm going to say Tadalafil. We're going to say Tadalafil for the reason that, this is a little awkward, but it has a long half-life, and so someone uses this, and you imagine someone saying, ta-da, under its effects. Ta-da, it works for a long half-life, okay? Because all right. And also T and the T 1/2 means half-life, so you can think T 1/2, help you remember the T, okay? So Tadalafil. Also, Tadalafil is an 11-phosphodiesterase inhibitor as well. So I don't know what 11-phosphodiesterase does exactly, but apparently this drug is also an 11-phosphodiesterase. And you could maybe remember that because since it has a longer half-life, goes longer, that it's going to be a bigger number than the other ones. The other ones are just 6. This one's got 11, which is a bigger number because it's longer half-life. Okay, person says ta-da because they have a long, all right, we'll go there. Okay, and then lastly we have Vardenafil, and all the main thing about this one is just we know that it's a weak 6-phosphodiesterase inhibitor as well. So it does similar effects as these other ones. Okay, so now we know what these drugs do. We have the names down: Sildenafil, Vardenafil, Tadalafil, and Vardenafil. Now we're going to talk about some of the adverse effects of taking these drugs. Well, apparently any drug that causes hypotension can have these first effects, which is headache and flushing. Blood vessels are expanding. It's going to maybe give you a headache. So those are the first ones, headache and flushing. Also the blue vision. It's associated with the phosphodiesterase 6 inhibitor. It also apparently can increase your risk of having a myocardial infarction in the case of CHD. And there's also could be a case of dyspepsia. So I don't know exactly what this means, but I'm going to take a guess here. I know that down here in your stomach, your glands are producing pepsin, okay, which digests your food. And dys means that something's not working, it's not functioning properly. So dyspepsia, I'm going to say that it's the esophagus isn't closing off, wherever that is down here. The esophageal sphincter, I guess, isn't closing off, and so maybe some of the peptic ulcers, the pepsin or whatever, the stomach acids and the enzymes are able to get up out through there, and they might cause you to have, I don't know, maybe heartburn. That's a guess. So the dyspepsia from a relaxed esophagus, because it relaxes smooth muscle, remember? There's smooth muscle down there. Also, it can have anterior optic ischemic neuropathy, which I don't know how that works, but apparently this can cause anterior optic ischemic neuropathy, so know that. And also mild hypertension, which is, of course, this is a smooth muscle relaxant. Anything that relaxes smooth muscle like this could probably cause hypertension. This makes sense. But what about drug interactions? Sometimes you take a drug and it has a negative effect with another drug that you're taking. Well, you need to understand that these drugs they directly potentiate hypotensive effects. So if a person is hypotensive, we don't want to give this to them. That'd be dangerous, that'd be bad, okay? Any other drug that is causing hypotension might, it's going to have a further effect with taking this drug because it relaxes smooth muscle. That's how it aids with the erection, is it relaxes smooth muscle, more blood goes in there, it becomes engorged. Okay, so also drug interactions is that sometimes this will interact with some of the alpha-1 blockers associated with orthostatic hypotension. So good thing to know, alpha-1 blockers could interact with some of those. And lastly, the Cytochrome P450 enzymes that break down drugs. You take one Cytochrome P450 interacting drug, it's going to increase the metabolism of the other drugs that are also metabolized by Cytochrome P450. But there's different Cytochrome P450s. This particular one that says this is 3A4. How are you going to memorize that? Well, since these drugs are associated with penile erection, it probably makes sense to turn the 3 and the 4 or something into something that looks like a penis. This is somewhat crude, and I apologize, but maybe you could think of those as testicles. That would be the 3, and maybe this is the 4, which would be the penis. So maybe the 3 and the 4 will help you to remember that it has interactions with 3A4, the sildenafil, vardenafil, tadalafil, and abamafil. 3A4. Okay, so some of the drugs that are also metabolized by this, here's a little list here: macrolide antibiotics, azole antifungals, statin drugs like somatostatin, and antiretroviral drugs. Okay, those are the 4 drugs that are or the classes of drugs that are metabolized by CYP3A4. So if you're taking sildenafil or one of these other drugs with those, you're going to have interactions. It's going to affect the way that this is metabolized. That's it.